So this patient's coming in for removal of a mobile mass. It's fairly big on her elbow. I've marked the incision line, but it actually extends beyond that. Seems most consistent with a cyst. Thing seems bilobulated, so it's like going through here and then there's a smaller tail through here. Like I said, feels cystic. Could be like pulmonous as well, but doesn't quite have that same quality. So we're just going to dissect that down and then sort of see what we're dealing with, then remove that. Stipulates has been growing for about 3-4 months. A little bit fast for this, but could be. So we'll see what that's dealing with. So no pain when I do that to her? It doesn't hurt?
No, I don't think so.
Okay. There's a bit of a language barrier with the patient, so we'll have to explain things the best we can. So just let her know that from this point forward, she shouldn't feel much more than just pressure. So if she feels anything more than that, let me know and I'll add more freezing in. Okay? All good? Okay. And then we'll hope to get this. This position is probably not terribly comfortable for her either. Scissor number 15 blade. So skin here is very thin. So like most things in life, there's good and bad to having sort of thin skin and redundant skin. So from the repair perspective afterwards, having this come together will be a bit easier, but it gives a bit more than regular skin does, which makes it a bit more difficult to work with. So when you're doing your initial incisions, shifts a bit more, gives a bit more than you would ideally like. I hope none of that's nasty.
My voice coming on YouTube.
Oh, okay.
That'll be okay.
So the other thing you get into in these areas too is there's a burst that overlies the elbow as well, and sometimes that can get acutely swollen and give people trouble. That looks slightly different as well, so to see when we remove this what we're dealing with. She's okay?
Yeah.
Essentially all I'm trying to do here is break down adhesions, and just like any other cyst we would do is we're just trying to get it down to the point where we can see that we're behind it into the hypodermis, and then see if we can dissect that back around the other way. Have that for me. Grab the scissors.
This one, big one?
This is the area that felt like there's a bilobe compartment to it, so I'm just progressing a bit slowly here to see if I can actually get around that. Bring this back down. She still comfortable?
Yeah, I like it.
Does that hurt? Oh, your throat hurts.
That's the whole thing. But she's
It's a
going to
dry
a little bit, she said.
So it seems like a lot of bleeding here. These are just small capillaries that are rupturing. Just put it underneath it right here. See the small capillary just there? Cut off a second. So at this stage, I'm not trying to rupture the membrane. I'm just, sometimes when it's intact and it's tense, I can actually see behind it a little bit better. Just gonna remove this in 1 second, Rana. Just take that off there. Pull that back. subclavian tissue right there. Looks pretty clean, so we're going to clean this up in 1 second. I'm just going to put this here. You're okay? Good? So this is the part you could tell from the outside where it looked like it had a secondary lobe, which was here. Now whether this is full, we'll take a look. Yeah, so it's all cystic. So that whole thing is cystic. So and this is why I try to not rupture it, just so we know that it's completely removed. So we'll send that off to pathology, which should be good. So you can see here the tendons tissues are thinner, so just above, see the tendons underneath there? That's just at the back end of the hypodermis. I'm just going to irrigate this. Now these ones typically when I take out a cyst, especially an uninfected cyst, like a lot of times we don't, actually the majority of times.
Oh, here.
We won't use antibiotics, but this one, it's this close to a joint, I would, just to be careful. It's not hurting at all? No pain? So again, most of this is just superficial stuff. As I was always telling you before, I don't mind a little bit of oozing. And the advantage we have here with something that's on your arm, we can put a compressive stocking or dressing. That should catch these and tamponade them for us anyway. Put pressure on that one, grab it.
Sure.
Grab it. So this is where there is some advantage for the redundant skin. Whereas normally I'd certainly put in some dermal stitches here. I'm going to elect not to because I think we'll get away without it anyway. So it appears like a lot of bleeding here. It's all coming from vessels right along the margin of the skin, and that's why I'm just electing to close this. And that should be able to just do a pressure dressing, and then that will take care of those. She's still comfortable?
Yeah.
So we should be seeing that as I progress along with this, that there's less oozing coming out bottom because we're tamponading these vessels. And this is why this is a bit different than I would be handling this if this was deep in the back or intra-abdominal. Yeah, I need another one. So we're almost done.
Thank you.
So you can see here it's not bleeding as much anymore. That's because through here, you can see they're still oozing where those vessels are slowly tamponading. So that means the vessel's been compressed, but it's just oozing just a little bit. And that won't cause a problem from the standpoint of post-op hematoma or anything like that. And then the other advantage is here, let's even say we had a brisk bleed and we couldn't locate the vessel for whatever reason. You can just put a lot of pressure on this because there's a bone at the middle of it that'll compress back and allow that to stop. There we go. So we'll just clean this up with some chlorhexidine, and then we'll put a dressing on that, and then we'll see her back in about 10 days.
अच्छा, तो ये ना आज हमारे बाल बहुत ख़राब हुए हुए हैं। ये अब आप लोगों को दिखाता हूँ। जो हमारे बाल है ना जी, बहुत ही ख़राब हुए हैं। ये देखो, यहाँ से तूंत निकल गई है। हमारे ना हमने बाल कटिंग करवानी है, पर वो कटिंग के लिए टाइम नहीं मिल रहा मुझे। तो ये आप देख सकते हैं कितने ख़राब हो गए हैं बाल, बहुत बड़े बड़े हो गए हैं बाल मेरे। और ये देखें, बहुत ही ख़राब है बाल मेरे, और बाल भी बड़े हुए हुए हैं। मैंने ये साइड अभी कट नहीं करवाई, बहुत टाइम हो गया है, तो इनको भी कट करवाना है। ये आप लोग देख सकते हैं ये कितने बुरे हो गए हैं बाल मेरे, और ऊपर से भी मेरे बाल ख़राब हो गए हैं। तो आप लोग भी रिकमेंड करो कि मुझे क्या करना चाहिए, इन बालों को मैं कैसे सेट कर सकता हूँ, और ताकि इनको मैं सेट करूँ और मज़ा आए बाल इंजॉय करने का। तो ये मेरे बाल सेट नहीं हो रहे, आप लोगों से मुझे मशवरा चाहिए कि मैं इसको किस तरह सेट करूं। तो ये आप लोग, मेरे बाल हैं जी, ये सेट नहीं हो रहे जी, और ये इसको हमने सेट करवाना है जी, ठीक है। तो आप लोग बताएं कि मैं हम इसे कैसे सेट करवा सकते हैं। थैंक यू।